So we're going to discuss a little bit about Titre testing, okay, and the pros and cons of it. The problems of Titre testing in the past include lack of efficacy. We don't really know how well it works. Does it really tell you your pet is protected? And more importantly, it's a lack of follow-up advice. So if we get a Titre test that says, yes, your dog is protected or your pet is protected, the advice was quite limited to what we can tell the owners. What they're actually saying is that it's protected right now. What is your immune system in a particular dog going to be like in a week's time, in a month's time, or 6 months' time? They couldn't predict that. So it was not very useful for owners, for me, if I said, look, yep, we done a Titre test and against distemper, hepatitis, parvovirus, it's okay. Then the next question they ask is, so when do we test it again? Then I'll be like, this is hard to say because there wasn't any sort of a follow-up advice from the lab itself. So that itself didn't make Titre testing that useful. Options available right now. Okay, so we got various labs doing it. Okay, which usually comes to the first the problem of the lack of follow-up advice. This particular company called CVC comes up with this particular test called Vaccinate. And this has been a little bit more useful because it actually advises you how much protection does that individual pet have, and more importantly, when would be the next recommended check be, as in how long would this protection last in this particular individual. So Vaccinate, it is available for distemper, hepatitis, and parvovirus. So for the three core vaccines that, vaccines on the viruses that we vaccinate against. So just remember that these are the viruses. Okay, so as I remind, so distemper, hepatitis, parvo, they're all viruses. It actually measures the antibody levels in the blood. So basically, when we give a vaccination to an animal, what happens is that the body immune system recognizes that particular vaccine and produces antibodies specific to that particular disease. Okay, so what this Vaccinate does is actually measures the antibody levels in the blood. Okay, the grades are from 1 to 6. Anything above 2, like 2, 3, 4, 5, 6, is adequate for 1 year. And we got fairly quick results from it, get it within 2 to 3 days. So this is useful because if it is graded 0 to 1, we know that the animal is in need of boosting up the immunity again. If it is above 1, as in 2, 3, 4, 5, 6, we can actually tell the owner, because we know that there will be enough antibodies in the blood system to last for at least a year. Then we can check the vaccinations, we can check the Titre testing in the following year as well. So that is useful. It allows vets and owners to make informed decisions, to say, okay, good, your dog is now protected or not protected, and if it's protected, when should we check it again? Okay, it's actually approved by the World Small Animal Vet Association, so the WSVA. It is not available for leptospirosis because it is a bacteria, not a virus. They're looking for different sort of antibodies, and the antibody to a bacteria does not last as long as a virus, which is why we still recommend vaccination of lepto to be done every year, because the immunity that's mounted, the protection that's mounted, is much less than immunity mounted for a, say, virus. Cool. Okay, so when do we use Vaccinate? When is it useful? To determine whether it's optimal to end a vaccine series. Okay, so when animals, they are vaccinated, sometimes people like to know whether the animal is truly protected so that we can stop vaccinating the particular individual. Now, after a dog or cat vaccine, to indicate immunization success was achieved. So very, very similar to the first one, to find a result to make sure that we can actually say that this dog or cat is adequately protected against that particular disease or diseases. To determine if a booster is required, so this is a more common usage of it, whereby vaccination time has arrived and we want to know whether we need to give DHP or not, and so we do a Titre test to check whether this animal has got protection against DHP, or in cats RCP, to make sure that we're vaccinating for the right reasons. to ascertain whether existing protection for a lapsed dog or cat vaccination program. So it well could be that the animal has missed out a particular vaccine, like maybe the second puppy vaccine or something like that, to check whether it actually needs to continue vaccinating, or is it actually protected from the first lot of vaccines that was given. To test stray abandoned animals with no clinical history. So it is very, very useful for shelters when you just get a new animal with absolutely no medical history whatsoever, and the question is, do we vaccinate or not? And they can certainly do a titre testing to check whether they need to vaccinate the animal or not. To test animals on immunosuppressive treatment. So if an animal, say, has got is on a particular immunosuppressive treatment like cyclosporine for skin issues, or potentially even chemotherapy for cancer, then it's just to check whether that particular animal has still got any more protection inside the system for the diseases that's vaccinating against, or do we need to give that animal a vaccination. It also can be used as part of annual health check programs. So we do sort of advise animals to be seen at least on a yearly basis, if not twice a year, and we can certainly use that just to check whether the vaccination status is adequate or not. It can also help to minimize the risk of adverse effects of vaccination. So for example, if an animal has had a known adverse effect, or suffer from a known adverse effect from a particular vaccination in the past, this can certainly help us to check whether we need to give the vaccination or not, because there is the benefit-risk issue. Potentially reduces the risk of over-vaccination consequences. As you can imagine, this particular test is created by not a vaccine company, and hence they are saying that potentially if you vaccinate too many issues, you may get problems, and hence they just do a check to make sure that everything is okay, or rather there isn't a risk of over-vaccination.